Hello viewers, you're welcome to this YouTube channel called Health Tips and Tricks. I am called Dr. Andrew, and I will be taking you through today some of the chronic medical conditions which affect our health. If you're new to this channel, don't forget to subscribe and continue viewing our videos. I'm going to be addressing some of the questions which you sent in to our channel, and I hope you pay attention and learn from this. To go to question number one, someone from Mexico City said, "Hello, doctor. I am called Ruby from Mexico City, South America. I would like to know what can make someone get a heart attack. Who is at highest risk to get a heart attack? Because I'm so worried. We have just buried a friend of mine who died of heart attack. How can I protect myself from getting heart attack?" All right. So first of all, before we go into this, we have to first understand what is a heart attack. The heart is an organ in the body which helps to supply blood and oxygen to the rest of the body parts in order to help us do our activities. For example, in the brain to think, in the muscles to do our daily work, like going to the office, you need your muscles to work. The muscles need blood, they need oxygen. So it is the heart's duty to give them this. The brain, every time you're thinking, you need oxygen, you need blood. It is the heart's duty to give you this. You have the kidneys, which are helping you to make urine and to remove wastes from your body. They need the heart to function. So in short, the rest of all our body depends on the function of the heart. So the heart is a very important part of the body, because without it, you cannot be able to do your daily activities. So what is a heart attack? So for the heart to function, it also needs support. Just like it supports other body organs to do their work, it also needs support. It needs to also get blood, it needs to get oxygen in order to function well. Therefore, it has also things we call blood vessels, which bring the blood and the oxygen, just like any other body organ. So when the heart receives blood and oxygen and nutrition, nourishment, this is when it is able to do its activities, to pump the blood and support the rest of the body organs. So when we say someone has a heart attack, what exactly do we mean? So if the heart is not getting what it is supposed to get, it cannot function. And a heart attack simply means the blood vessels which are bringing blood and oxygen to the heart to enable it function have got a problem, and they can no longer bring this blood and oxygen. It's like, for example, if you have your car or a vehicle has an engine. So if the engine is not receiving fuel, it cannot function. The car cannot start. You need to get fuel into your engine for the car to start. So if you cut off the oil supply, if you cut off the fuel, the engine will not be able to work. That is the same way the heart inside our bodies works. It is the engine of the body. If it doesn't receive nourishment, that is blood, oxygen, it will not be able to function, and our bodies cannot function. So a heart attack is the condition you get when your blood vessels, which are supposed to bring oxygen and blood to your heart, are no longer functional, when they get a deficit and they cannot bring blood to your heart effectively. What are some of the things that can make this happen? One, the blood vessels may get blocked. They get blocked and blood and oxygen can no longer reach your heart. Therefore, your heart stops functioning well and you get what we call a heart attack. Number two, the heart might be requiring a lot, it might be having a lot of demand. For example, if the engine needs, for example, 1 liter of fuel to function, and I only give it half a liter, it will not what? It will not function. So the same applies to our heart. If the heart has a lot of work to do, and it needs a certain amount of oxygen and blood, and it is not getting this required amount, then it will also not function. The blood vessels are not blocked, they are functioning, but they are not bringing enough. So that can also give you what we call a heart attack. So how does this happen? For example, the first scenario we talked about, of where the blood vessels get blocked. What can cause blood vessels to get blocked and not bring enough oxygen and blood to the heart? These are quite many things. To begin with, our very lifestyle. For example, the kind of food we eat. So, food which is rich in fats, food which has a lot of fat, and this is mostly we are talking about fat from animals or animal products. This fat is not very good fat for your body. Why? Because the more you take it and it accumulates in your blood, it will form what we call a certain kind of fat which is not good. Why? Because this fat can easily attach to your blood vessels. So look at it like this. For example, you have your water pipes in a home. You have water pipes which bring water. So if the pipes get clogged, maybe they are metallic and they become rusty, the water will stop coming. The rust will build up in the pipes. The same applies to your blood vessels. The blood vessels are supposed to bring blood and oxygen. But if you keep taking these fats from animals, they keep clogging the blood vessel, clogging it. If I could just use a simple illustration, if this is the heart, and then we have our blood vessel here, it is bringing blood to the heart. So, if our blood vessel is bringing blood to the heart, and you eat a lot of animal fat, so the fat starts building up, and it causes clogging of this blood vessel. So the blood cannot easily reach the heart. So if this happens, you will get what we call a heart attack. All right. And then, two, we talked about the heart not getting enough of what it needs. So for example, you might get a disease which needs your heart to pump very fast. For example, you don't have enough blood, or you might be having a disease where your heart beats very fast. So when the heart beats very fast, it means it requires higher amounts of energy. So it needs higher amounts of oxygen and higher amounts of blood and nutrition. So if you are not able to receive this, you can also get what we call a heart attack. And then, of course, we have other many factors which can also affect the blood vessels which bring blood to the heart. For example, lifestyles like smoking. Smoking is one of the things which will bring toxins in the body. And these toxins will also affect your blood vessels which bring blood to your heart. And that makes the heart become unable to receive enough oxygen and blood. And also there are some people who have predispositions, genetics in their family. Sometimes a genetic component can also come in, but it is not the only factor. And then we have other factors like lifestyles like alcohol consumption. Alcohol is also a toxin when it reaches the body. We have diseases, some viral infections, bacterial infections. So all these diseases which you can easily get and they affect your blood vessels can all bring damage to the blood vessels which come to the heart and cause a reduction in supply of oxygen and blood to the heart, hence contributing to development of heart attacks. So as we have seen, to get a heart attack, it is a whole collection of several factors which come into play and work together to lead you to a heart attack. Having any one of these may not necessarily make you get a heart attack, but all these coming together. So the more factors you have, the higher your chances of developing a heart attack. So coming to the specific question which was asked by our friend from Mexico, it says, I would like to know what can make someone get heart attack. I think some of those, we have talked about them. And the highest risk, people who have engaged in lifestyle activities like smoking, alcohol intake, people who eat a lot of animal fat and products of animals, which can easily lead to this buildup of fats in the blood vessels. And then also, there is some element of genetic predisposition. And people who have suffered from diseases, viral infections, bacterial infections, and also people who are exposed to toxins, smoke from vehicles, from factories. All these can contribute to and increase the risk of getting a heart attack. And then he says, I am so worried. We have just buried a friend of mine who died of a heart attack. Okay, and how can I protect myself from getting a heart attack? So to protect yourself, you need to address some of these exposures in case you have them in your life. For example, we can talk about diet. Maybe you're a kind of person who has been consuming a lot of animal products. All the time, all your diet is mainly made up of animal products which have animal fat. So one, you can reduce this consumption and increase consumption of foods which are products from plants. For example, vegetables, fruits, fiber. These are foods which are from plants. If it is oil, you can use vegetable oil, which has cholesterol free. So all this can help us reduce animal product consumption and thus reduce buildup of these bad fats, which can easily predispose us to getting a heart attack. Number two, exercises. Exercise is one thing which will help your body to consume the food you have taken in. When we take up food, it could be carbohydrate, protein, or even fat, which we have already talked about. This food can be used in different ways by the body. Initially, the primary goal is to provide energy to the body, energy for doing different things, energy for doing activities, energy for growth of cells, and other functions in the body. However, the remainder of this is stored. Most of it is stored in form of fat. And some of this fat can be converted and is deposited in the blood vessels and leads to risk of getting a heart attack. So how can we reduce this? By utilizing the food we are taking in. If you take in carbohydrate and utilize it, do exercises, use it so that it doesn't build up. If you take in fat, use it. So exercise is another very important way of reducing the risk of getting a heart attack. Then we can talk about going for a daily checkup to your doctor. Going for a checkup will help you to realize some of the risks which could be coming up and also get to know what is happening with your body so that these can be addressed in the nick of time before they complicate. And then, of course, other risky lifestyles. Things like smoking, things like alcohol consumption, and exposure to other toxins. These we can also address them and reduce them so that we can promote a healthy lifestyle. So the next, it says, if someone gets a heart attack at home, what should I do to overcome it? So we all have our relatives at home and friends, and some we stay with them. And some of these could be having underlying heart diseases or even when they are very healthy individuals. So the question is, when a patient gets a heart attack at home, what can I do? What and how, maybe how can I even recognize it? So a heart attack is something which can happen suddenly without the person even having any prior warning. For example, you could be there doing your daily activities and all of a sudden you feel a sharp pain in the chest and then you collapse. And when they take you to hospital, they realize you had a heart attack. So we should be vigilant at home, especially if we have people whom we know, for example, the elderly, people who have risky lifestyle, and other people whom we know have been kind of sickly, and even the normal people who don't have any other condition going on. If someone suddenly complains of chest pain, maybe they were doing an activity, they suddenly complain of chest pain. Someone suddenly complains of feeling breathless. Maybe they were doing an activity and they are unable all of a sudden. We should, in the immediate effect, first of all, make these patients comfortable, relieve them, lie them down, let them get air, and then we consider putting them on a form of transport and taking them to the hospital immediately for further attention. Because if a heart attack happens and the person delays to get to the hospital, then more of their heart gets damaged. And once more of their heart gets damaged, it will be difficult to reverse this damage. But the earlier, the better, because if a patient goes to hospital earlier, this damage can possibly be reversed. And even if it is not possible, he or she can get early treatment and prevention of further complications. So some of the things that can be done, for example, a patient who has got a heart attack, in the early stages of the heart attack, procedures can be done to try and open up these blood vessels which are bringing blood to the heart. Going back to the illustration here, if you get to hospital early, so when this blood vessel blocks off completely and your heart is no longer getting blood, then this part which is supposed to get blood will be killed off. So if you go to hospital early, we have procedures that can be done, and then this heart is opened up again. And once it is opened up, blood will be able to come and flow again, and your heart can get better. Alternatively, we can use some drugs to help your blood flow more smoothly so that your heart continuously gets a good blood supply. Some of you could have heard of drugs like aspirin for the heart, which is one common drug we use for patients who have a heart attack to enable their blood move smoothly and reach their heart muscles and supply them with oxygen so that the heart can function efficiently. And some other treatments which of course your doctor will tell you about and teach you about them and how to use them so that you prevent some of the complications that can happen. A heart attack which is not well managed, like I said, will cause more damage of the heart muscle, and this can progress and become what we call heart failure. So what is heart failure? Heart failure is when your heart now fails, and then you now start again another level of treatment to try and help your heart do its activities. But the idea of treating a heart attack early is to avoid the complication of it turning into heart failure. That was the first question, and I hope this response helps Ruby from Mexico City to learn more about this and be able to prevent it. So in conclusion, we have seen that a heart attack is a condition where your heart is not getting enough blood and oxygen to enable it function, just like your vehicle may not be getting fuel to the engine to enable it move. And we have seen that some of the things which can be risk factors for this are, one, a bit of element of genetic predisposition, risky lifestyles like smoking and alcohol intake, excessive. And then we also have other factors like diet, a diet which has high animal products. And we have seen that some of the ways of preventing heart attacks are, one, living a healthy lifestyle, doing exercises so that we promote utilization of the fats we take in, and also refraining from risky lifestyles like smoking and excessive alcohol intake. And when a colleague or a friend gets a heart attack, either at home or at work, the best thing to do for them is to make sure they get to hospital and get urgent attention. I hope this has been helpful, and I hope we have been able to learn more about heart attack from this presentation. And so I remain Dr. Andrew. Thanks again for listening to this and for your attention, and I hope you've been able to learn from this. If you have any questions or comments, please feel free to comment in the section below for further responses. And also like our video and also share with your friends so that we all support each other to improve our health and reduce the risk of heart attack among our people and loved ones out there.